Working with ZIEL was an incredibly rewarding for us this past semester. What we realized is that the process the ZIEL uses to plan and put on and then debrief simulations is robust, it's organized, it's detailed. They're able to walk us step by step through what we need to do to plan a simulation that really meets the learning needs of our learners and our multidisciplinary team.
The change is pretty remarkable, and overall I think it's how realistic it can be here is the biggest difference. So especially with this sort of interdisciplinary team that we always have nursing staff and things like that, but the equipment that we have is what we actually have in the hospital. The monitors that we have and the meds that we're pushing and everything else are exactly the same as what we see on our inpatient unit and on our PICU.
And the process when you first are introduced to it is rather daunting. What I really have come to appreciate is that the ZIEL staff has pushed our simulation to really think beyond just running a task training simulation. Simulation in ZIEL is much more than just doing an action and repeating it and getting better at it. It's really planning learning objectives. What do you want your learners to take from the simulation?
The more simulation I see a lot of our residents do, the more confident they get about their medical skills. But again, it's that sort of leadership and running a team that changes the most, I think. A lot of them know what to do, but they have to practice saying it and doing it and coordinating with a team.
Prior to the Code Blue team arriving, we don't have a team of experts or a specialized team that helps that patient. So we decided to develop a program that focuses on the training of those individuals for the first 3 to 5 minutes.
In this case, with Travis, you could kind of see him rolling through his head. He's like talking, we need to get CPR started. We need to get the backboard under the patient. We need to get the bag valve mask, the AED. He was kind of going through the checklist in his head.
We started switching off CPR. Everything went very smoothly, and I think that was largely due to training. Even at one point, the oxygen wasn't up to 15, and I was just going through the list, and I had them turn up to 15.
It really was a as perfect as these things can be, simulation. Everyone had a role, everyone had a purpose, there was no confusion, nobody was yelling. Everything was running very, very impressively.
After the code, just like recovering from that and moving on, I feel like the training was extremely helpful in that because I did everything I could have done. And otherwise, I could be having all this guilt, like I should have done this, I should have done this, but I felt prepared going in, and that really helped me on the back end.